Hi, my name is Dr. Barrett. I'm a board certified plastic surgeon here in Beverly Hills. I'm going to talk to you really quick about candidates for surgery. We all know that it obviously depends on the particular type of procedure that you're interested in, but there's some general guidelines that we like to look at to make sure that surgery is safe for you. Number one is BMI. What is your body mass index? That's a calculation based off of your height and your weight that determines whether or not you are overweight or obese. If it's greater than 25, you're overweight. If it's greater than 30, you're considered to be obese. Generally speaking, we don't like to operate on people with a BMI over 30. The other big no-no for surgical candidates is smoking, okay? There's a reason why smoking is bad for surgical patients. The main reason why is that nicotine and the other products in smoke, they inhibit the process called angiogenesis. That is a new ingrowth of blood vessels that happens after surgery, and it happens right along incision. So what are the problems we see? We see breakdowns in incisions. We see skin necrosis. Actually, skin will die in smokers. Even in simple operations such as breast augmentation, it's important to stop smoking at least 6 weeks prior to your operation and 6 weeks after to get that out of your system so you have the proper ability to heal. The other category is fitness. Are you strong? Can you recover from your tummy tuck? You have to use accessory muscles, right? So we encourage our patients to be an active fitness regimen before undergoing surgery to help them recover, because if you're losing part of your muscles in one area, your other part of the muscles need to compensate for that. So if you're getting breast surgery, you need your core muscles because you can't use your arms, so on and so forth. So that's something we recommend for all of our patients. Fourth thing, medical problems. If you have diabetes, if you have asthma, these are things that we need to get checked out with your primary care provider before you're having surgery. More importantly, how is your heart function? Do you have any heart problems? If you had a previous heart attack within 6 months, we can't operate on you because we know statistically you're more likely to suffer adverse consequence within 6 months of having a previous heart attack. Realistic expectations is probably the most important thing that a candidate of surgery has to consider. Is this something that's going to meet your goals? I get a lot of people that come in and I ask them to bring desired photos, and sometimes their expectations are way out of line of what we actually can do. That's a main reason why I put everything out there on the internet. I want people to see what the surgery can do. I want people to see what the surgery can't do. I don't want to sign you up for surgery, have you take all this time off, spend all this money, and then you don't get the results you're looking for, mainly because what you think could have happened, we can't really do. A lot of TV shows kind of capitalize on this in a wrong way where they try to make you into a different person. Really, plastic surgery can't make you into a different person. It can make you a more enhanced version of yourself, but major drastic changes really isn't possible with plastic surgery. Lastly, plastic surgery is a very intimate decision. It has to be done for all the right reasons. If you're in here because your boyfriend wants you to have bigger breasts, we are not going to do your operation. It has to come from you. And that's very important, because if you break up with that boyfriend and you have bigger breasts now, you're stuck with that decision and you're going to be unhappy. Obviously, we screen all of our patients for that, and patients that might be having any conditions such as body dysmorphia. That's where you're obsessed about a part of your body that may not look as bad as you think it does. So in general, if I have a patient that thinks that one part of their body is way out of proportion to what I think, we have to have a discussion about it. Sometimes you have to even see a psychiatrist to evaluate the person to make sure that that is something that they can get corrected and that they're realistic in their expectations. So that's it for our little video today, you guys. It's good to know if you're a good surgical candidate. Obviously, go through those 6 different things. And if you have any questions or any particular thoughts about whether you might be a good candidate, give us a call. 310-598-2648. Check out our website, drdanielbarrett.com. We have a virtual consultation right there. You can send in photos, you can send in your history, and also feel free to leave your comments, questions, feedback right here on my YouTube page. And don't forget to subscribe and give me a thumbs up. Thank you guys. I'll see you in surgery.